Welcome to Age Well Together, proudly presented by Sunscape Boca Raton. Step into a world of care, connection, and cherished moments. We invite you and your loved ones to embark on a journey where each show is crafted with comfort, compassion, and exceptional care. Join the conversation that enhances the richness of this new chapter in life. For more information, contact Sunscape Boca at 561-782-7910 and let us help you embrace the beauty of aging well together.
Good evening. I'm Lori Rolat. I'm the Director of Community Relations at Sunscape of Boca Raton. Sunscape of Boca Raton is the new assisted and memory care community that recently opened on Boca Rio Road. You can reach me for more information at 561-680-3600 or take a look at sunscapebocaraton.com. My guests tonight are Rosie and Joe Martin and her husband Joe Martin, co-owners of Allegiance Home Health. Joe Martin has been a physical therapist since 1996. He graduated from the University of Florida with the Bachelor's of Science in Exercise Physiology. He then worked with amateur and professional athletes at the United States Tennis Association and Miami Dolphins, respectively. He then pursued his Master's of Science in Physical Therapy from Nova Southeastern University, followed by doctoral studies in the manual therapy at University of St. Augustine. With his wife, Rosie, they owned and operated an outpatient physical therapy clinic in Boynton Beach for 14 years, and then founded Allegiance Home Health in 2005. Joe believes in giving back to the community and is currently serving on the board at the Park Vista High School Special Academics, Habitat for Humanity of Palm Beach County, FAU College of Nursing, and the 100 Club of Palm Beach County. Rosie began her career as a teacher for students with learning disabilities after graduating from the Florida Atlantic University. She was inspired to become a teacher after her nephew passed away from leukemia. She went on to manage her husband Joe's physical therapy clinic, and as she helped it grow to become successful, they founded Allegiance Home Health in 2005. Rosie has been very involved in the community, including sitting on the board of the YMCA, the American Association of Caregiving Youth, FAU College and Nursing, West Boca Medical Center Governing Board. Rosie and Joe have been nominated for many awards, including the Small Business Leaders of the Year by the Boca Raton Chamber of Commerce, and Rosie believes in giving back and leading by example. Well, welcome, Rosie and Joe. Thank you for being here today.
Thank you, Lynn.
Thank you.
So tell me more about how you opened up your home health agency. How did that come about?
Well, as you mentioned, Joe and I had a outpatient physical therapy clinic together, and our patients were asking Joe if they could see him at home. Sorry.
That's okay.
What do I do about that?
We keep talking. So our patient, we saw a need for home health, not only with our patients, but at the time Rosie's mother was having an illness. And when, at the time, she had an insurance that when they sent out home health, the services weren't what we thought they would be, and Rosie wasn't happy with them. Do you want to pick up from here?
And many of our patients were asking Joe if they could treat them at home because they were unhappy with their home health care services. And that's when Joe and I said, you know, we can make a difference and we can open our own home health agency, hire the right clinicians that feel it's their calling to take care of seniors at home, and that's what we did.
And what are the top 3 things to choose when somebody is choosing a home health agency?
Well, we think some of the time, I mean, there's many things to choose from when determining a home health agency, but number one, you could look at their reputation, and a lot of that can be done online. I mean, if you go to Medicare.gov, you can go to the, look at the star ratings for a home health agency, and we do have a 5-star Medicare rating. Number 2 is you can make sure that they have direct employees and not independent contractors. And if you want
and also, of course, I'm not I'm totally off. I mean, is there, what?
Can we cut it?
Can we just cut, can you cut like after she talks and then add it, or no? Yes?
Okay.
Okay,
Yeah, because we need this for tomorrow, so we don't have a whole lot of time.
okay, okay. Okay,
Okay.
sorry, I'm just,
I know, I
was
feel the same.
completely,
I know.
Yeah, but you know what? If it's okay
Yeah.
to mess up a little bit.
no, I
mean,
know,
it's-
but I thought that it could be cut, and then I could just say
Edit it.
sorry, so I can't.
Okay.
So like, I just, if you ask the question again, the first one.
Let me
and-
do it. Let's start
Okay.
over, okay?
Sorry about that.
You're fine. If you
Okay.
just mess up, just go straight through with it.
Okay.
Because I don't know how long this show's gonna last if we just pause for every.
No, I understand
Okay.
that.
so
All
just
right.
go
Okay,
with it.
okay.
Okay, so ready? Mm-hmm. Can we go? All right. Rosie and Joe, how did you get into home health care?
Well, as you mentioned earlier, we had a outpatient physical therapy clinic, and my mom received home health services, and I was very unhappy with them, unfortunately. And Joe's patients were asking him to treat their loved one, a neighbor, or their spouse at home for physical therapy. They were receiving also home health services, and they were unhappy. And that's when Joe and I said, you know, we can really make a difference. Hire the right clinicians, and hire clinicians that feel like it's a calling to help seniors at home, make them feel better, give them dignity, and that's what Joe and I are all about. And that's when we decided to open up Allegiance Home Health in 2005.
Back in 2005, there weren't as many home health agencies as there are now. So how did you find, as a startup home health agency, to get off of the ground in Palm Beach County?
So what we did is we kind of had a little network because of our physical therapy clinic. So we first reached out to those in the community who were aware of the services that we provided, and then it slowly built. You know, you can't jump in and expect to have a huge agency at the beginning, but as people became accustomed with our care, word of mouth came about, and in the medical community we developed a reputation of providing quality service and compassionate care. So we were able to grow organically over the years.
That's true, and because we do have, patients have patient choice, and what really was happening in our situation was the patients were asking their physician to please write a prescription for home health, specifically because they wanted to use Allegiance Home Health because they trusted and believed in our care.
What are the top 3 things for people to decide when they are choosing a home health care agency?
That's a great question. I would think the Medicare star rating, for instance, Allegiance Home Health, we are a 5-star rated Medicare certified home health agency. It's something that we receive quarterly, and that's because of our patient outcomes. We're very proud of that, and that's because of our wonderful team, our staff, our clinicians. And Joe, what else would you say?
Well, and that could be researched online by anybody. You can go to medicare.gov and put in home health compare, and you can compare all those Medicare certified agencies and how their quality of care is. But I would say, you know, beyond looking at their star rating, I would say also inquire on their employees. You know, do they use direct employees or do they use independent contractors? We use all direct employees because we feel that, you know, if we're preaching peace of mind to families, that we shouldn't send an independent contractor out to your house that we're not really responsible for. So all of our direct employees are covered under our umbrella of protection, unemployment, workers' comp, malpractice, general liability. If an unfortunate event were to occur in the home, it's all covered under our company. Whereas if you were an independent contractor, that would not be covered.
So that brings up another question for me is, how do you train somebody to become a caregiver for Allegiance Home Health? What does your training entail?
So we do an onboarding process that involves orientation and make sure that the director of that department is a nurse, okay, and a lot of the caregivers should be certified nursing assistants or home health aides to begin with. But they go through our orientation, and then according to their skills and the patient or client's needs, they might be a little more educated as far as, just to give you an example, like congestive heart failure, recognizing early warning symptoms that can prevent a hospitalization, or whatever it may be. We might have somebody in the past who was a baker, and we want to find a caregiver, who has an interest in baking. But the first part is finding good people, making sure we interview them well, making sure we train them well, and then we also have ongoing continuing education where they have to have 12 continuing education units a year. So we provide one a month at no fee to keep them trained in a lot of the cases that we see.
And we also, all of our caregivers, all of our staff, they all have a level 2 background check.
That's wonderful. Do you have to be discharged from a hospital in order to receive home health care services?
No, you do not. Many people think that in order to receive home health care services, they have to be discharged from a hospital, and that is not true. Anytime, if you have fallen, if you have problems with your gait, if you see that you're not able to even put on your clothing and you're losing your balance when you're buttoning a blouse or putting on a shirt, we can provide occupational therapy for your upper extremities. We can provide physical therapy to strengthen and make sure that to prevent you from falling, because falling is something that will end up having a patient in the hospital.
Right, and you can be diagnosed with a new diagnosis, a change in medication, you can have a wound, a skin tear that does not require hospitalization. There's a lot of things that go on medically that do not require hospitalization, but would allow you to have home health.
And what about insurance? What insurance covers home health services, or this is all a private pay?
So, Medicare covers skilled care 100%. Skilled care being a physician's prescription, meaning you need some type of skilled nursing, physical therapy, speech therapy, occupational therapy, or social services. That's considered skilled care through insurance. Medicare covers that 100%. But then there's the other side of it, which are the caregivers, which is the private side. Do you want to talk about that?
Yes, the private side would, if you have long-term care insurance covers the private caregiving. What we do at Allegiance is we have our director of our private duty department call the long-term care insurance along with the patient or the power of attorney or whomever is responsible for finding out about the insurance that's available. Our nurse then asks questions to the insurance company, and it's a three-way call, so they know that all the services are available to them as far as the amount of money that is allotted to them daily.
And there are some veterans programs that will also pay for private caregivers. As Rosie mentioned, we'll do things to try to adjust depending on the budget and the amount, because every long-term care policy pays for a different amount. But whatever we can do to maximize that. And unfortunately, if you don't have those veterans programs or long-term care or some county programs, it is out of pocket, which will also work with you and your family to make sure that we find a happy medium where the services are provided that are needed, but you could still afford them.
Wow, that's wonderful. Now that we have grown up and kids are growing up and we have aging parents, how often are you finding that your friends are calling asking for information on home health services or actually need it?
Wow, that happens a lot, and we are happy to answer any questions. In fact, not only do we have friends calling us, we have people who live up north and they are asking about home health services, even if we know that they are not going to be a client of ours because they're not going to come to Florida, they're going to stay living up north. We feel like it's our calling to help them and give them all the information they need, because when you are placed in a position where now you have to determine the kind of care that your parent needs and the type of insurance they already have, and you have never really ever looked into that, we are so happy to help someone. When we hang up that phone, we really feel like we made such a difference and we gave someone peace of mind. And we always tell them, please call us again. We're not asking you to become our patient. We just want to help you because we understand. Joe and I had elderly parents, and we also had to go through that. So we know firsthand how difficult it is to balance taking care of your parents, having children as well as working.
And that's what happens with me when I'm getting calls from family members looking for their aging parent that needs assisted living or memory care. That I'm the first point of contact to give them the peace of mind, sharing the services that we at Sunscape has to offer. That being said, we've partnered with you at Allegiance to bring in home health services, but also physical therapy for our residents that need it, so they don't have to go out. They can get it done at our fitness center. I feel that this partnership has been invaluable, and want to know who else you've partnered with in the community. How did you get started working with assisted living communities doing physical therapy and also home health services?
So we've partnered with hospitals in the past. We've partnered with attorneys' offices, doctors' offices. We used to partner with the City of Boca, the basketball league, you know, with injuries at the youth basketball, and it's just really a matter of building community partnerships. The assisted living communities have been a great partnership for us because we kind of benefit each other, right? So when we have a client or patient that is looking for more socialization, or their level is declining to the point where they can't afford the private duty they need at home, or they just, you know, want to be in a controlled environment that's nice and safe and everything, we're able to refer to assisted living. And likewise, those who are in an assisted living facility may need some physical therapy or other services to remain as independent as they can and be as happy and healthy as they can, because that's really the spirit, the culture of these communities, and Sunscape has a great spirit and culture to them when you walk through the front door. So we want to be part of helping continue that, and that's where the partnership, I think, really thrives between us and home assisted living facilities. Sorry.
And I agree as well. And with that, we're going to take a commercial break. But for more information on Sunscape of Boca Raton, call 561-680-3600. We'll be right back with Rosie and Joe Martin.
Discover a vibrant oasis where comfort meets exceptional care. Whether you're seeking assisted living or memory care, our dedicated team is here to provide compassionate support and enriching experience for you or your loved ones. Join our Sunscape family and experience a new chapter of life filled with care, connection, and cherished moments. Schedule a tour today to see our beautifully designed community and learn more about how we can tailor our services to meet your needs. Your new adventure awaits at Sunscape Boca Raton. We're easy to reach and eager to answer any questions you may have about your future at Sunscape. Please call us at 561-559-9544 to make an appointment in person or virtually through FaceTime, Zoom, or Skype. We are located at 22501 Boca Raton Road and hope you'll be as excited as we are to see every side of you shine at Sunscape.
Now, let's dive back into the show and continue our journey toward a healthier and more enriching life. Stay tuned and let's age well together. For more details, reach out to Sunscape Boca at 561-782-7910 or sunscapebocaraton.com. And now back to the show.
Welcome back to Age Well Together. I'm Lori Rolat. I'm the Director of Community Relations at Sunscape of Boca Raton. Sunscape of Boca Raton is the new assisted and memory care community opened this past year on Boca Raton Road. For more information, you can reach me at 561-680-3600 or check us out at sunscapebocaraton.com. I'm here today with my guests, Rosie and Joe Martin with Allegiance Home Health. Sunscape of Boca Raton and Allegiance have formed a wonderful partnership to help the residents of Sunscape of Boca stay healthy, active, and fit without ever having to leave the community. We encourage independence and for having people to reach their full potential each and every day. And with the help of Allegiance Home Health, helping our residents do physical therapy in the community it's easier for them to get the necessary PT that they need. So I want to thank you for this wonderful partnership. I know that we've had quite a many residents already using your services at the community. I would like to hear your thoughts about how we are doing as the newest assisted and memory care community in Boca Raton.
Well, I think you're doing wonderful. What I see when I walk into your community, I don't see it, I feel it. I feel happiness. I see residents walking around, socializing. I walk into that beautiful area when you first walk in, you're walking and you see a grand staircase, and then you continue and you see the dining room, and your residents are sitting there talking and laughing. It's like a country club. It's really like a country club setting. There's no isolation. They're busy. They're doing activities, and then you make that left-hand turn and you walk in and you see this beautiful bar, a bar that I would love to have in my home. It is amazing, and again, people talking. It is really about giving your residents happiness, keeping them away from being sitting in their room. They're encouraged to leave. You're always talking about activities, and they're not just simple activities. I see activities that really that you provide are for the residents to be thinking, for their cognitive, if they have cognitive issues, for them to continue to be strong. Don't you agree, Joe?
Yeah, I mean, I think what is hard to understand for those who don't have an aging loved one, or if they live out of the area, how, you remember somebody in a certain way. We go through this, not just Rosie and I, but Lori probably deals with it on a daily basis also, is you have families who are either out of the area or maybe close by, but they don't visit as much as they thought they did, their aging loved one. And when you really get down to the quality of life that some of these seniors are living in, it's really, there's a role to play when you have an assisted living community like this. I mean, I think Rosie expanded on that pretty good, but it's quality of life involves, not just physical functioning, which I take care of as a physical therapist. It's very important to be able to get out of the chair yourself. It's very important to be able to walk independently, get to the restroom when you need to go, safely get to the dining room and your food and your self-hygiene as far as self-bathing and all those physical things that need to be done on a daily basis. But there's also the psychological and social aspects of being around others. And social isolation, we saw how bad it was during COVID. It was terrible on children that couldn't be in school, and it was terrible for seniors that couldn't see their loved ones. And I think we learned a lot through that socialization is very important. And sometimes we speak with families that are out of the area, and it's not that it's not that you don't know what's going on. Sometimes it's hard when you're not right there for the body language and to see the situation that's exactly going on. And, as far as Sunscape or us providing home health services, we're trying to fill a void in that person's life that really gives them quality of life and gives them the life that they've really earned and worked for all their life. So I think that as far as the assisted living community, Sunscape, the home health agencies providing care, I think it's great because there is a need for that in our society. And I think that it kind of gets lost in the shuffle a little bit with everybody living their day-to-day life, and we're so busy before we retire that it gets overlooked a little bit.
I agree. I mean, I see the joy that the residents have when they move in and they find each other and they make friends. I'm the first point of contact. So in the beginning, it's a lot of, I don't do this and I don't do that. I don't social, I'm gonna stay in my room. And the fact is that they don't. As you mentioned, COVID was detrimental to children and older adults. And to have a community where everything is just so easy for them to have a day, such as going into the dining room, and our dining room is open all day. We're not telling anybody when to eat. But even starting the day after that with the chair exercises that your company provides, whether it's water aerobics or chair exercises with water bottles, even those that are not ambulatory are participating because it's a group setting. They're with their friends now and like-minded, and they're feeling good. They're being encouraged and being engaged. We now started bartending classes, which is a lot of fun. A lot of mocktails, but not all mocktails. And just different discussion groups in music and entertainment and a card room. We've got canasta, mahjong players. We'll soon have bridge games as well. So it's very important for an older adult to still reach their full potential. And for more information, you can reach me at sunscapebocaraton.com or 561-680-3600. This is Age Well Together with Rosie and Joe Martin of Allegiance Home Health. Thank you.
Thank you for joining us today on Age Well Together, brought to you by Sunscape Boca Raton. We've delved into the essential topics that matter to families as their loved ones step. Thank you for joining.
Ending, let's get a couple of minutes of their service.
Okay.
And then if you have any new things coming up, or do you have open houses, do you have events, talk about, you've got the up and
Our
coming art
services,
show.
I mean,
Yes.
physical therapy,
Okay.
I'd rather have too
speech
much, we
therapy,
can sit down, we're
nursing.
editing, if we can cut it, then
Okay.
we have empty
Private
airtime.
caregiver.
Okay, great. Okay. Let me know when you're ready.
You
I'll
guys
talk
ready?
about what we have and then I'll throw it over to you.
All right,
It's rolling.
okay.
So for more information on Sunscape of Boca Raton, you can reach me at 561-680-3600. We are proud to be part of the Walk to End Alzheimer's of Boca Raton that happens at the South County Regional Park in November. We will be hosting 2 art shows to raise money for the Sunscape Boca Raton walk page. The first one will be in March and the second in August. Again, for those dates, you can reach me at 561-680-3600. And you can call me anytime to schedule a time to come in and take a tour of our beautiful community. Rosie and Joe Martin are now going to talk about the services that they offer at their Allegiance Home Health Care.
So the services we provide are skilled nursing, physical therapy, occupational therapy, speech therapy, and of course our caregivers. All of our employees are W-2 employees. We have longevity in our team, which we're very proud of. We have employees that have been working for us as long as 18 years. And also, I'd like to say that we are going to give you our phone number, which is 561-367-0711. That's something that we are very proud of. From the time you call Allegiance Home Health, there's always someone there to help. Please call us at 561-367-0711. We really, truly love to help.
Yeah, and if you have any questions, I mean, I'm sure not just myself, Rosie, Lori, call if you have questions about navigating the healthcare system. It doesn't have to just be if you think you need home health or you don't think you need home health. Call us up, let us help you solve whatever issues you may be having. We may not be able to do it ourselves, but between the 3 of us, we could direct you in the right direction to get the solutions you need.
And you know what I want to say? My biggest advice is don't wait for that rainy day. If you wait for that rainy day, it's almost too late, and then nothing is organized. You really need to have that talk and think about, is it a good place for my family member, my loved one, to be in a community like Sunscape where they will receive so much care and socialization? Let's start talking about that. Let's not wait until our loved one needs to go in and then they feel forced. Because something that they don't understand is home health and a community like Sunscape, that does not limit them it doesn't limit them, it actually creates
Gives you more independence.
Right. It actually creates independence.
As Lori was speaking of
Right.
earlier, it's there's always a level of resistance with change.
Yes.
And as you're mentioning, your residents that don't want to come out of the room at first, and before you know it, they're down taking your mixology classes and everything else, because there's a level of resistance, but it actually makes you more independent once you realize what's going on.
Our philosophy is that we want to empower the residents to reach their full potential every day. And yes, use us as a resource, if nothing else. And you can do so by reaching me at 561-680-3600. I'm Lori Rolat with Age Well Together, and I want to thank you, my guests, Joe and Rosie Martin with Allegiance
Thank
Home
you.
Health.
Thank you.
Have a good night.
Thank you for joining us today on Age Well Together, brought to you by Sunscape Boca Raton. We've delved into the essential topics that matter to families as their loved ones step into the next chapter of life within a secure, picturesque, and engaging living community. Take the next step towards a vibrant and fulfilling life. Until next time, stay tuned and age well together.